Alrighty. Hello, everybody. Welcome. Thank you so much for taking your time to join us tonight. Really glad you're here. For those of you who aren't super familiar with us, I'm Danielle Angelari, and I'm with NAMI Northern Illinois, an affiliate of the National Alliance on Mental Illness dedicated to improving lives of individuals and families living with mental health conditions through education, support, and advocacy. Everything we do, you'll learn more tonight, is grounded in that lived experience and the belief that change is possible when people come together. Just before we dive in, I want to share a few quick updates on our end. We have a lot coming up this year, but I'll just really start with the rest of January. So next week on the 22nd, we are doing our second Leading the Conversation webinar with Ava Zeidner from Thresholds. She's going to be doing psychosis early intervention for providers. So if you're looking for CEUs, that would be a perfect time for you. And I can send all of these afterwards in a follow-up email. Then on also the same day in the evening, we're doing a little recreational workshop, going to Pottery Lounge here in Rockford, and we're going to do some painting. So come unwind with us, get to know us, bring a friend, all free of charge. And then at the end of the month on the 29th, we're doing our first of three of our Chase Away the Winter Blues trivia series. That's at Park Lanes in Loves Park. Bring your smartest friends, leave with prizes. And then just for future note, keep an eye out for our Building Bridges event in May, Mental Health Month. That's our signature community event that we do in tandem with the Winnebago County Community Mental Health Board. And then our Mulligans for Mental Illness, our annual fundraiser, will be June 1st of this year. Now, I'm excited to introduce our today's speaker, Tony Ohlhausen. He has been involved with NAMI for 8 years and currently serves as the Director of Research and Policy at NAMI Illinois. In this role, Tony works to amplify voices of people with mental health conditions and their loved ones across the state to drive real systemic change. His work has helped expand mental health supports on college campuses, advance ongoing reforms to Illinois' forensic mental health system, and secure long-term funding for the state's mental health crisis response system. Prior to joining NAMI Illinois in 2023, Tony advocated for local and statewide policy through a local NAMI affiliate, bringing both a grassroots and statewide perspective to this work. We're grateful not only for his expertise, but for his commitment to lived experience-driven advocacy. So Tony, thanks for being here tonight. Just for the crowd, we're gonna try to save questions till the end, but if you want to pop them in the Q&A feature, we can at least save them there so you don't forget. And then we'll open it up at the end, and I think that's all for housekeeping, really. Tony, I'll hand it over to you.
Great. Thanks, Danielle, and thanks for having me tonight on a lovely January Tuesday evening. So let me just get my screen set up here quick and share the right thing. There we go. All right, cool. You should be able to see that. Oh, good. And I updated that slide right with the right date. Cool. All right. Good evening, everyone. Excuse me. I've got a little frog in my throat, so I apologize in advance for having to clear that, and hopefully I won't cough too much on you guys. But thanks for joining tonight. As Danielle said, I'm Tony Ohlhausen. I'm the Director of Research and Policy with NAMI Illinois. So let me got to control the right screen. There we go. So just wanted to give you a quick agenda on kind of what we'll be covering tonight. So first, I'll start just with a couple minutes about who NAMI Illinois is, kind of what our role as the state organization is, and what we do to support our local affiliates and do statewide. And I want to talk just a little bit about why we advocate, why it's important for NAMI to be involved in advocacy, and why it's important to have folks like all of you on the call tonight join us. And then I'll get into the really exciting part that is our policy agenda, and then happy to, hear what questions you have what you've been hearing about in terms of legislation policy that's been going on. There's a lot going on these days for good and bad. So depending on your perspective and what we're talking about. So I'm looking forward to that discussion and opening it up too. So with that little agenda said, NAMI Illinois is the statewide or the state organization of the National Alliance on Mental Illness. So our main role is to provide support for our local network of affiliates, as well as expanding our geographic reach. You can see on the screen there that I think is the most recent one. It's been a little while since I made sure I updated this, but we have our 21 local affiliates across the state that you can see on the map there. All of that gray are areas that are not covered, are not served by any NAMI affiliate. So part of our role is to change that and get affiliates up and running and expand our reach across the state. Now, where I fit in with NAMI and our role as a statewide organization is advocacy and public awareness. So I lead our statewide policy and advocacy. So I drive our policy agenda that I'll be talking about in a little bit, based on what I hear, what I and others at the state organization hear from the communities that we serve, from our local affiliates, and we translate that into a policy agenda and change. And so we're kind of we take the lead on the state level, and then my role is to implement is also to implement that policy agenda, which we'll be talking about here tonight, and supporting our local affiliates in engaging in local advocacy, as well as bringing them into our statewide advocacy to maximize our impact. So with that, I even have fancy transition with the slide. So why do we advocate, and why is that important? And I spend a lot of time thinking about this question, and talking with folks about this question. And it's in my day to day, it's kind of it's easy sometimes to forget why I do the things that I do, and why I'm in this role, and kind of why I show up every day. Um, but but even before I kind of get into that, I did want to just kind of clarify what I mean by advocacy, because we all come from our own perspectives. Advocacy can mean a lot of different things, which is great. But when I'm talking about advocacy tonight, I'm not necessarily talking about kind of that personal level advocacy of me going to my doctor, or advocating to for an individual, whether that's myself or someone that I care about. Right. So that is certainly advocacy, certainly extremely important, and really the basis of what NAMI does. And there's also the system level advocacy, right? So that's our legislation, reforming systems, and not and kind of zooming out from the individual and looking at how are people and how is society served by the systems and the laws that govern those individual interactions. So there's a lot of big questions. It can be a whole really just overwhelming and intimidating to think about talking with legislators. And laws are in the United States are inherently often written so to make them not accessible to most people. And I don't have a law degree, and it's often very difficult to even figure out what a proposed legislation even means, or existing law even means. So but that doesn't mean that everyone can't engage in advocacy. And to the contrary, I think that makes it even more important for for NAMI and organizations like ours to be a loud and present voice and make sure that we're engaging, excuse me, folks like all of you and making sure that you feel empowered and have the tools to use your voice. Because you know, getting back to the question, that's all important because decisions get made by the people who show up and who are there to make when decisions are made, right? So, if we're talking about I'm having meetings about how do we create a mental health crisis response system that serves people that does what we think it should do. The people, the decisions that get made there and the laws that get written and passed are written and passed by the people who are there and showing up, and NAMI is there. NAMI is at the table in those discussions, and I think that's really important. I strive to bring the lived experience perspective to those conversations that are often had by attorneys and administrative leaders and legislators and providers who we need providers, but they have their own perspective, and a lot of times that perspective aligns with what I think what NAMI and lived experience advocates think is good, but sometimes we disagree, and it's important to have those disagreements and those discussions. So, you know, it matters who shows up. It matters being at the table. I think I always think about the phrase, if you're not at the table, you're on the menu. I think that that's a really important sentiment for a grassroots organization like NAMI and advocates like us. So the other real a really important reason why advocacy is another really important reason. There's lots of them. Why advocacy is important is that I talk to a lot of legislators. I've met a lot of legislators, and I think legislators, when you really boil it down, want two things. One, they want to do the right thing, and two, they want to get reelected. And it might sound really easy to do the right thing, but if you don't understand the implications of the decision that you're making as a legislator, and you don't understand the problem and what people experience in the real world, it's really hard to make the right decision and do the right thing, even if that's what you're looking to do. And so, when NAMI advocates go talk to their legislators or other policymakers, the I've seen legislators' eyes open when someone tells them their story and why mental health is so important, or why a certain policy issue is so important, a certain proposal is really important, and why they need to spend their time and energy championing a given issue. And the example that I always think of is in 2018, 2019, a year or two before the pandemic, I helped advocate for the passage of a law, or now it's a law, called the Mental Health Early Action on Campus Act. And that's a law that's, I think, pretty unique to the state of Illinois, because we lay out the minimum expectations of a public college and university on what it means to provide mental health support for students on campuses. So that's things like making sure that there are enough mental health counselors on campus, making sure that staff and students are trained in what mental health means and how to support if for faculty, how to support a student, or for students, how to support each other, and recognize when a fellow classmate might need a little more support and where to find that support. So the legislation does things like that, and And it's been, I think, really, really important for colleges, and I'm still involved in implementing that law, working with college campuses across the state. But as we were advocating for that law, we would meet with legislators and tell them about the issues and tell them about how college students were really struggling. And we would get a lot of nods and a lot of thank you for being here from legislators, until one day had a, a mother with us who's excuse me, who lost her daughter to suicide while her daughter was a student at college. And she told her story and her daughter's story to this legislator. And following that meeting, he I think a couple of days later we received a call from the state legislator. And he was so moved by that story that he made that piece of legislation his top priority that session. And he saw that bill, or we saw that bill pass with his leadership. So and that was one story that really made the difference. So the more stories that legislators hear, the more that they're educated about the importance of mental health, and advancing mental health policy, and the laws and proposals that we're supporting, really goes a long way. And I hear from legislators all the time, or state legislators here in Illinois all the time. If they receive three calls on a given bill, um, to whether they should be supporting or opposing that bill, that really means something to them, because they don't normally hear from people. So if one office gets three calls, that's a huge deal. So if all 10 people on this call tonight, I think, or if that number is accurate, I don't usually do the panelist side of webinars, but if all 10 of us were to call, our state legislators, and told them that they should be voting for, I don't know, House Bill 123, for example, that would really really make them stop and put some time into that, into understanding that bill. So that's why I think this is really important, because legislators want to do the right thing. I truly believe that. Maybe there's some that care less about doing the right thing, but most of the time they want to do the right thing. But we need to tell them what that means and what that is. So that was a whole lot about why advocacy is important, and I hope that made sense. So I could talk all day, so I got to stop myself on that. But so I also want to talk more concretely about oh, whoops, I forgot to update the slide. This should be 2026. Not, it's also 2025, but we're in 2026 now. Excuse me. So, I also I want to spend some time talking about, what we're looking at doing, excuse me, in 2026. So, we have our general policy platform that gets voted on every October, that kind of guides NAMI Illinois' policy priorities, just in general. These are the main issues that we talk about, that we care about. These are the issues that we'll generally focus on for that year. So these issues have been relatively consistent for the last couple of years. And you can see on the slide that we spend a lot of our time focusing on expanding support for youth and young adults. We talk a lot about the mental health crisis response system. I think everyone on this call probably knows that there's a mental health workforce shortage, and we need it's hard to find a mental health professional. Or it can be difficult to find a mental health professional that has the expertise and the skills to provide the services that a given individual needs. And just in general, we know access to mental health care, especially effective mental health care, is not equal, depending on where you live, depending on who your insurer is, if you have private insurance versus Medicaid or Medicare, your access or no insurance at all, your access to mental health treatment it does not look the same. So that that's a very high kind of high level. Actually, Danielle, I told you I was going to stop for questions. This is as good a spot as any. Um, are there any questions so far in the chat or Q&A?
I do not see any yet. If
Okay.
anyone has a question right away, you can put it in the Q&A.
Yeah, please do. I love Q&A much more than talking at people. So please do feel free to throw any questions or thoughts in the Q&A or anything that piques your interest, and I'm happy to spend some time, excuse me, diving into anything in particular. So this, we're getting a little bit more concrete, from, why are we advocating? What, what kind of generally do we support, or not support or oppose if if there's a proposal that we will harm access to effective mental health care. For example, that this we do oppose legislation as well. But what are we hoping to accomplish in 2026? Um, so one, our NAMI Illinois, we receive a relatively significant portion of our funding from the state through the state budget. Unfortunately, that means we get to go back to the state legislature every year and make sure that our funding is included so we're able to continue providing the support that we currently provide and expand across the state, like we saw in that map earlier this evening. So, without support from through the state budget, NAMI Illinois would struggle to do what we do every day. So one of our specific priorities is focusing on our funding. A lot of that funding then gets passed down to a number of our local affiliates that supports a lot of our programming across the state. And I believe this year we're anticipating that the 1.21 million, well, this year we actually got just under $1 million. Excuse me, for FY26. Uh, we anticipate that funding to support oh my gosh, served over 100,000 people with that 1.2 or $1 million. So you can see in bold here, our ask for the legislature is to prioritize that funding in the FY27 budget. So how you go about doing that, we'll talk about in a little bit once I think in like two more slides. So that's one of our main asks every single year. But we spend most of our time, or I spend most of my time educating legislators and talking about specific pieces of legislation. So this year we have we'll support more than just three bills, but this is kind of our top three priorities for this legislative session. And if you have questions about when the legislative session is, I'm happy to share more information about that. But now is a great time to hold legislative briefings because the legislative session starts next week. Excuse me. So two of the bills you see up here have bill numbers and one of them doesn't. That's because HB 2960 and SB 1480 were introduced last year, but did not pass out of the General Assembly and have yet to become law. That's a lot of reasons for that. Some of those reasons are administrative because of the way the legislature works. SB 1480, we ran out of time because we were negotiating on language, kind of bill language that would be most effective and lead to the results that we want to see, which is, as you can read there, that commercial excuse me, commercial insurers actually do end up paying their fair share for mental health crisis response services. So for both of those bills, we're currently working with the bill sponsors, Senator Laura Fine and Representative Laura. Oh my gosh, they're both Laura Favor Diaz, um, to make those bills stronger and really have the impact that we want to see. Which you can read on the slide there. SB 1480 would, like I said, would require insurance companies to cover mental health crisis response services. Right now, even though I think on paper, really by the letter of the law, commercial insurers should be already covering mental health crisis response services. Um, but in practice, they don't. And there's not a lot of providers that even try to bill commercial insurance for crisis response services. So as we continue to grow our crisis response system, we want to make sure that commercial insurance is actually putting up and not being subsidized by state funding, which is currently making up the entire state and federal funding, which is currently making up the entire budget, I suppose, for the crisis response system largely. And that's leaving a very large payer riding along free. And we know, I think, well, I certainly think that commercial insurance um, is the one, is the payer for healthcare services that has the most ability to pay. So they shouldn't be getting a free ride. HB 2960, I'm really excited about this legislation. This legislation was actually originally written by two high school students. If you were at NAMI Illinois' conference in October, they were these students, Abhinav and Sai. They were two of our keynote speakers, so really excited about to have them continue to engage with us and be real leaders for NAMI and for youth mental health in Illinois. So we're continuing to work with them and Rep. Favor Diaz to improve K-12 mental health education in our public schools. This is particularly important now because starting, I believe, in with the 2027-28 school year, all public schools will be required to offer all students a mental health screening. But we're of the opinion, and honestly, our state leaders agree with us that having a mental health screening and screening students for depression, anxiety, other symptoms of mental health conditions is great. But then the question is always, what do you do about it? And if I think the issue is twofold, right? One is if a student is experiencing symptoms but is afraid to even put that express that they're feeling depressed or anxious or whatever other symptoms they're experiencing down on paper, that they will be chastised for it, that they'll be singled out for it, that there will be negative social repercussions because the school culture does not understand what mental health is and is not accepting of mental health. They're probably not going to report those symptoms, right? And even if they do, if there's no, or if they don't believe that they will find support or that their teachers, again, will not be supportive or their fellow students won't be supportive of them, or there's no treatment available or other social supports available to address those symptoms, we're really failing those students. So it's obviously mental health education doesn't solve all problems, but it's really important to have that culture of care and an understanding culture within the school where it's okay to talk about your mental health. So that's really the crux of that bill. And then finally, we're working on a resolution. Normally, we don't do resolutions because if you're not familiar, a resolution versus a bill will actually create a law that requires someone to do something. It's a requirement. A resolution is more of a public statement and doesn't require, it's non-binding. So the legislature doesn't have to do anything, the state doesn't have to do anything, I don't have to do anything. However, the importance of a resolution is that it indicates and educates both legislators and the public about what the General Assembly's, in this case, the General Assembly's stance is on a given issue. So, excuse me. So the resolution that we're working on this year, the goal is really this came about in response to federal policy changes around criminalizing homelessness and mental illness. Um, excuse me. So that there was an executive order signed by the president in, I believe it was either June or July, I forget, that basically encourages states and municipalities to um, criminalize homelessness and mental health conditions. We don't, we, and frankly, the entire mental health, nearly, I think the entire mental health advocacy community in Illinois strongly disagrees with that, to say the least. But it's easy, I think it can be easy for legislators to think that they're doing the right thing or think that they're taking stances that will get them reelected, as we talked about before, um, and they will take actions and vote on things thinking that they're doing the right thing. But where the concern is that what they think the right thing might be is making it easier for people to um, be civilly committed to involuntary treatment or institutionalized because they have a mental health condition. We NAMI fundamentally disagrees that that should be the main way that people get mental health services. That should not be the way that we are treating people. Period. Especially for incredibly vulnerable folks who are experiencing homelessness. We know an outsized proportion of folks who experience homelessness have either a substance use disorder or a mental health condition, but that doesn't mean they need involuntary treatment, or that doesn't mean they should be locked up in a jail or a prison for the travesty of living on the street and not having a permanent place to live, and being ill. If someone had cancer, I don't think we would be locking them up in a hospital or shipping them off to prison because they have cancer and that led them to being homeless. So that's really the crux of why we think that resolution is important. We want to educate legislators about why community-based, person-centered voluntary treatment should be the standard. So there's lots of other legislation I could talk about. I see in the Q&A, Warren asks, excuse me, the current law, oh my gosh, if I can read. Did I say current law requires a mental health screening for all students? There was a law passed, I want to say in 2025 that it passed, or 2024. I'm forgetting right now, but that sets out an implementation timeline for all public K-12 schools to offer a mental health screening each year for all students. That doesn't mean the school needs to screen all students, but the screening must be offered to all students. So it's not required, but the screening is similar to is basically the same thing as um, uh, I think all students have vision and hearing screenings each at certain points or at the beginning of the school year. I know I do. So that's the vision there. And again, it's that where the state isn't forcing schools to, or well, the law isn't forcing students to go through a screening, but the school needs to offer it. I hope that makes sense. Um, okay. Not seeing any other questions. Feel free to pop any questions in the chat about these bills, other bills you've heard about. There's a lot out there. And I'm obviously focusing on the state level. There's a lot of other things going on out in the world. I'm happy to talk about those as well, either today or at some other point. I'll make sure Danielle gets the slides and she's able to send those out to you. My email's on the slides, so you can certainly find me and reach out. NAMI has a wide range of public policy positions. Our national organization leads on federal advocacy, and I'm in close contact with them on a whole host of issues. So um, I'm happy to talk about any of those questions you have, anything you're hearing about in the news. Excuse me. Um, the I think the last thing I wanted to talk about is one way that you can engage with advocacy with NAMI, and that's our Capital Day. We'll be down in Springfield on Wednesday, April 15th. I'll be down there more often than that. So if you find yourself down in Springfield, feel free to reach out. I might be down there too. I don't know. But I will only be down there if the legislature is down there. So if you're there on a weekend, I'm not going to be there. I'll tell you that right now. Um, but we are, so this will be the third year that NAMI Illinois, our third annual Capital Day. This year, I'm really excited about it. This year, we're partnering with three other organizations to host our Capital Day. I won't list them all, but they're basically the mental health trade organizations in the state that represent community providers. Um, so we'll have tables at the Capitol building. We'll have folders and resources for folks. Later, I think later this month, we'll have a registration link that will go live. There's no cost to participate, but we will have some T-shirts that will be selling at cost. So we kind of so folks can have something fun and colorful to wear that will make you a little bit more visible. Otherwise, you can always wear NAMI gear. NAMI Illinois' logo will be on the t-shirts, but it's not NAMI specific. And I know, I mean, I love wearing my NAMI stuff around. So if you come down that day, feel free to wear your NAMI gear. In March or April, again, later I can send more information on this later, but we will have a virtual prep session so everyone's feeling prepared. And like I've said now, three times I'll say it, or well, two or three times I'll say it one more time. We'll have more details to come on the specifics and the logistics, but I want to get the word out on the date as soon as possible. April 15th, because getting down to Springfield is kind of a pain in the butt. If you are in the Rockford area or Chicago area, it's not a short drive. So or a train ride. Honestly, I don't know if there's a train that goes from Rockford to Springfield, but hopefully there is. Excuse me. So please save the date there. And I will love to see as many folks from NAMI as possible down in Springfield. And we can do the wonderful work together. And also, I just ripped this photo off of the state tourism website. I didn't notice the little Abe graphic in the corner, so that's cute. Um, but I just said we got our Capital Day. Can also call it an advocacy day. If you're not already sold on wanting to come down and talk to legislators, I do just like giving a little overview of why I think advocacy days are important and why advocacy in general is important. I think this applies all around. You can make your voice heard. I see a lot of things in the news. I read a lot of stuff. I get a lot of emails that make me mad. And it feels good to tell somebody what you think. So this is a great way to do that, as long as you're doing it in a productive way. Um, and you can build, like I talked about a little bit earlier, you can build relationships with your legislators. That's really important, I think, for us as individuals to know who our legislators are, and more importantly, for them to know who you are. Because if they know who you are and you show up or you call them, they'll answer the phone, or they'll take a few minutes to hear what you got to say. And similar for NAMI. I don't even know how many legislative offices I've walked into, whether it's their district office in their community or down in Springfield. A legislator I've never talked to, and they have a NAMI sticker on their desk, or they've got a NAMI whatever on the wall. And that is because of the work that our community, or well, you guys all do. When you go talk about NAMI and the great things that NAMI Northern Illinois does with your local legislators, they listen to that, and they love positivity. They love hearing what you guys, or what our affiliates do and what you guys are working on, and it's important for them to know what's not working. Um, but when you build those relationships, and you talk to your legislators, they become more aware of mental health and why it's important. And I love, part of the reason I love working for NAMI is that everybody loves NAMI. It's I think it should be really easy to support NAMI in our legislative priorities, because we are, I believe we're focused on doing the right thing. And legislators, I think, understand that when we do go and talk to them. So the more that we do that, the more that they hear from us, the more that they know that we're watching them. We need as many legislative champions as we can get, and advocacy days and going to talk to your legislators is how we build those champions in the legislature. I know you've got over in Rockford, you've got a couple really great NAMI fans. Representative Maurice West. Every time I see him, he always tells me how much he loves NAMI Northern Illinois and the work that you guys do. Ooh,
I
uh,
love to hear that.
yeah, uh, as do I. So that's kind of the end of my slideshow. That's the end of my shtick. Let me stop sharing my screen so you don't have to look at that. Um, let's see. All right. So I mean,
Thank you
I
for
can
that.
talk forever, but go ahead.
Well, I was just saying thank you, and you can talk forever if you'd like. We love to hear it. Also, but I do have some questions just from some of the slides that you shared.
Please go ahead.
Um, I know it's coming like down the pipeline, the universal mental health screenings in schools, but has NAMI Illinois started to like formulate any recommendations for what that looks like in practice, or like safeguarding it, or like how will mental health professionals be embedded in the school, or is it more of like a referral base? Do we know?
Yeah, yeah. So I'll start with that kind of last question of like, where are the mental health professionals, right? Where will they be? I think that's probably the most difficult question to answer, and the current legislation doesn't really answer that question for better and worse. I say better because it's not prescriptive, because some areas if you have a really small school, it's like really cost prohibitive to have a dedicated mental health professional, and maybe there's not that many mental health professionals in your community to begin with. So it's, not, it doesn't make sense everywhere. But so giving schools the flexibility to do what that works for them is really important. There are a number of guardrails that I kind of mentioned, or I mentioned, I think the main one that's kind of baked into the legislation that NAMI and our network of advocates and other advocacy groups advocated for, that that all of these screenings are voluntary. It's easy, or the schools are required to offer opt-outs. I believe it's opt-outs and not an opt-in. So there's that. But it's like opting out of anything else in a school is what I imagine that would look like. Excuse me. So, we're not forcing treatment or screenings or anything like that on students. And a big part of the legislation is that ISB will be in the process of over the next couple of a year or two, developing guidelines for schools and districts across the state. So I believe they'll come up with either a list or one particular or one or two particular screening tools that are evidence-based, that if you go to a mental health professional, they'll give you the same one, like a PHQ-9 or something, those kinds of screeners. They'll identify kind of that list for schools and school districts to kind of help guide them and what that screening is, and making sure that they're evidence based and not just a random list of questions that someone came up with. As well as some of those guidelines and technical assistance for schools on what to do when a student or when they have a student screen, I guess, as positive. I'm still working out what the language is on that, as screened for having depression or anxiety or whatever. So, there are still some question marks, but NAMI Illinois is in pretty close contact with ISB and Dr. Weiner, who is the chief. Oh gosh, she's the head of the Children's Behavioral Health Transformation Initiative, or whatever it's called. And she's been kind of the driving force behind the school screening movement at the state. So we've got good friends there, and we're certainly at the table.
Thank you. Awesome. I'll switch over to the Q&A before I
Mhm.
go on. Do you have any notion of how the coming cuts to Medicaid will affect mental health care in Illinois?
Yes, that's a multi-billion-dollar question. Yeah, so I think the real world impact will not be good. We won't see increased access to mental health treatment because of the cuts to Medicaid. I that I can guarantee. How bad it will get, I'm not sure, and I'm sure it will look different in different communities, because we know, a third of the state, or about a third of the state, relies on Medicaid for their health insurance right now. Um, and up to a million, or I think up to 700,000 Illinoisans, which is like a third of people on Medicaid, are at risk of dropping off of the program. Um, and in rural Illinois, that proportion is much higher. In Black and Brown communities, that proportion is much higher as well. So we'll definitely see disproportionate impacts in different parts of the state, and different types of providers. There are a lot of providers, who are the big ones out by you guys, wrote the Rosecrances of the world, that, not to pick on them, but that's just the first one that came to mind. Um, most of their clients are on Medicaid or are uninsured. So I anticipate that they will see the biggest challenges in terms of keeping their doors open and keeping their capacity. Um, that said, I personally know the person at the Department of Healthcare and Family Services, who's been hired to lead the implementation of HR1, the federal law that created the Medicaid work requirements and championed all of these wonderful Medicaid cuts that we're talking about and we're worried about. And she is a an advocate, so she's on our side. I wholeheartedly believe and wants to do the right thing. So it's on it's on us to make sure that to hold her accountable and her team accountable and the state accountable to make sure that whatever flexibilities and opportunities the state can have to reduce the impact of these cuts and keep as many people as possible on Medicaid. We need to make sure that we're doing that, and also supporting the state and making sure that they're doing the right thing.
Thank you. We are looking to kind of reintroduce our like local advocacy committee. So how can we in turn help you and national and just be a bigger, louder voice?
Yeah, that's a great question, and the slide that probably should have had on my PowerPoint. But so a number of local affiliates have advocacy committees, and I think a few of them have started them back up in the last couple of years. So I think you're in a path and a track that's very similar to other affiliates. I know NAMI McHenry has, I think last year, maybe, yeah, I think it was last year, they started an advocate, kind of revamped their advocacy committee as well. Um, and in full transparency, NAMI Illinois board is also revamping our own board advocacy committee. So, I think um, what I would suggest is I'm happy to make any connections, but talking to your counterparts, and seeing what worked for them, but also you understanding your community and your needs, and knowing who your champions are in your service area, and do, creating a committee that works for you guys. And I think you guys know the issues that I mean, not just Rockford, because you guys have a much larger area than that, but the issues that are really important to your folks, and kind of trying to coalesce around those. That hopefully that's like not a complete non-answer and is kind of helpful, but I think focusing on one or two things and not trying to bite like swallow the apple whole.
For
Um,
sure.
yeah.
Thank you. Do you want to talk at all about, I know you mentioned workforce, just different things that are happening in that arena, and maybe a little bit crisis response too?
Yeah. Yes, I did kind of gloss over those, and I see another question in the chat about the workforce, specifically the CRSS program. Um, let's see. I would love to connect you. Feel free to reach out about CRSS and bringing CRSS to NIU, or I'm assuming Northern Illinois is NIU, or just in general. No, NIU isn't in your, it's further east, I think. Wherever NIU is, and the colleges and universities in your area. Um, I can certainly get you hooked up with the folks that run the program at the state, and I'm not 100% certain on kind of the timeline for, or what it looks like to create a new site. But where I think they've worked really well, areas like DuPage and kind of metro suburban, those affiliate areas, and McHenry as well. Excuse me, is the our NAMI affiliates have really strong partnerships with the colleges that and universities that are leading the CRSS program, and offering that for students, as this is a big ask for you maybe, but being kind of that internship placement, and just being a partner for and support for those students. But I think starting that conversation with the colleges and universities as well, because obviously they would be the host site, and we want host sites that are really excited about the program to lead it and not just have it because they can or because they get a check for it from the state. So there's that, and then workforce more broadly. We're me and Sarah, my boss and our executive director at NAMI, Illinois, we have regular meetings with the state's um, uh, behavioral health workforce center, where we talk about, um, our perspective on what the state should be doing and where we should be spending our time and energy as a state in developing and expanding our mental health workforce. So a lot of the things that we focus on are front end recruitment. So we NAMI Illinois, we've got a couple of pilot programs that we're working on that we would love to see adopted other places. I think we'll have a couple new sites across the state, but as we're implementing that, we're really encouraging the Behavioral Health Workforce Center to think about not just how we can get more psychiatrists, psychologists, and social workers, but how we can create career pathways for peers, for people who don't want to necessarily go the clinical route, but want to be be in the mental health field, and maybe as a peer support professional or a family. Oh my gosh, I'm blanking on how to say this, but peer support family or family peer support. There we go. Jesus Christ. Family peer support professionals, and making those pathways. So, that if you're a peer support professional 5 years down the line, you want to go back and you do want to get your MSW, right? How are we supporting that professional in their own career growth? And how are we getting people from high school, from middle school into and showing them that peer support or clinical professions too are viable professions? Because I mean, I think the common knowledge or the common trope is, why would you want to be a mental health professional when you could just go work at Starbucks and make the same amount of money? That's a lot of work, and being a social worker is a lot, well, maybe usually a lot harder than working at Starbucks. Maybe sometimes it's similar work, but depending on where your Starbucks is. But so those are the kinds of things that we're supporting this year. I don't think we'll have much legislation for the workforce, um, but we are working on administrative advocacy there, and that doesn't mean we're not talking about it. And then on the crisis system, I mentioned SB 1480. That bill would require commercial insurance coverage, which isn't like changing the game tomorrow. But in 2025, we did have, or the state created, Illinois became the 12th state in the country to implement a 988 telecommunications fee. It's basically very similar to how we pay for 911. We project that fee will bring in about 40 to $50 million each year, but we'll see, what that actually looks like now that it's implemented and we're actually collecting money, because the projection and the reality often aren't quite the same. So, we're at the table on how that money gets spent, and where that money goes, and it'll be really important to make sure to hold the state accountable that they're actually getting that money out the door. We see in other states, I always think of California, where they have a millionaire tax, that a portion of that, billions of dollars a year in that state are supposed to be for behavioral health services and supports. And there's a lot of criticism of that funding mechanism there, because for years they were not able to get that money out the door. And I think they still struggle to actually spend that money that they're raising to do the things that they say they should do. And so, we want to make sure we want to do everything that we can to support the state in actually getting that money out the door so we can actually see change in our communities and see that mental health crisis response system flourish, which includes the workforce.
I was gonna ask on same note, kind of 988. Do you have any like insights overall through the state on CESA.
Yeah. So CESA, for folks that maybe aren't as familiar, is oh gosh, now I have to be familiar to remember what it stands for. But I'm not going to actually, I was going to try to parse out what it means. But CESA is a state law that basically set up a statewide board and 11 regions across the state to oversee the development and the implementation of a mental health crisis response system. So there are 11 regions that are responsible for coordinating across emergency departments, mental health crisis response, and law enforcement, basically, is the short way to say that, I think. Um, and ooh, thanks, Warren. Um, yeah, the Community Emergency Services and Support Act. Thank you. Um, so yeah, implementation has been slow on that. I'm not sh Well, I think they have until July of 2027 now to fully implement CESA. I'm, I would uh, I'm not sure what region you guys are in or if you span a couple regions, but I would encourage everyone on this call to attend your local regional meeting as regularly as possible. They should be posted publicly because they are public meetings on the DHS website. And Danielle, if you aren't sure where to look for that, I can certainly find it, and you might already be on the board. So, or someone from NAMI Northern Illinois might already be on the board. It's been a little bit since I've looked at the roster, but that's a great way to stay involved and be involved in local advocacy. That's really important and impactful. So I know well, I haven't looked in a little bit, but I think 6 or 7 of the regions have NAMI appointed members. And I know most of the regions are really hungry for people who will actually show up and do the work. I would highly encourage being involved in the local racks if you're not already, for Danielle and everyone on the call.
I am involved in Region 1. Um, However, it does feel a little bit slow moving, and they're really getting down to the pilot side of things, and Region 1 is kind of split up pretty differently than I would envision because there's Winnebago County, but it's mostly like DeKalb and a little bit further that way. So it's very separate operating systems.
Yeah, yeah, that's a lot of different types of geography to reconcile. Right? Yeah, yeah, and I mean, I would also say, just because like your experience is not the abnormal experience for CESA. I think really the only region that I know that I've heard that's like going well is DuPage. Um, and whatever region number that is, I don't know. Um, they but they were our before CESA, they were already, I think, probably the leading area in the state for mental health crisis response, which, I mean, not really that high of a bar, but I think even before CESA, they were kind of doing their own thing, and they have a lot of resources over there in that county, so that's also helpful. But I know, like NAMI Chicago has been getting more involved in Region 11, which is just the city of Chicago, and they've been looking more to go a little more rogue, like relatively rogue. I don't think it's actually rogue, but not waiting around for the state is really what I mean by that. To start implementing things, which is easy when you have money, but I'm happy to support however I can if there are specific questions that are coming up, or if there's a lot of times there are a lot of regions have issues um, getting either the EMS director kind of bought in, or the local 911 call center, the PSAPs, on board. So if you're having any issues like that with specific stakeholders who aren't engaging, I can certainly try and um, you know workshop solutions there, or whatever else. I'm also trying to get on the statewide advisory council, but I'm waiting to hear back from them.
Well,
Yeah.
I hope you do.
Well, I I usually hope that I do, and then I get the picture.
I've got another workforce question. Are there any laws in Illinois that compensate companies for making workplace accommodations to help people with mental health conditions gain and keep employment?
That's a really interesting question. I am not 100% sure. As far as I'm aware, I haven't heard of kind of a law that directly compensates companies for making workplace accommodations. Um, that said, I'm trying to remember because there was a proposed bill, and I'll have to look back to see if it actually passed a couple of years ago that would have created a tax credit for employers who employ certain people with mental health conditions who I think they might have to have like a formal disability diagnosis or something like that. But I would have to go back and look to see if that was actually implemented. But that would be the closest thing that I would know
Thank you. Do you want to touch AI at all?
of. We do have a position on AI or part of AI because there's a lot of different things going on. There's so if you're not aware, ooh, Warren, you're like on it. I love it. Um, if you're not aware, in 2025, Illinois passed a law that was signed by the governor that uh, basically bans companies from marketing and using AI as mental health therapists. So that uh, I had heard some presentations from these technology companies, not provider companies, that have developed AI chatbots specifically designed to be therapists, which sounds great, might work okay for some people, but even in their own kind of data analysis of how good their products are, they there were two separate companies with two separate chatbots that I saw presentations for, and both of them reported that their AI therapists told at least a dozen people each that they should attempt suicide. Um, and if you've used AI, ChatGPT, Copilot, you know that they're not the greatest things in the world. And even if it's 80% accurate, 20% is really bad. If you're driving on the road and people follow the law 80% of the time, there's going to be a lot of people that die. And I think with no matter how fast AI improves, going from 0 to 80 is maybe not quite as hard. But as with many things in life, going from 80 to 100, if you're a C student, you're trying to get to be an A student, that's pretty tough. Going from F to C, that shouldn't be too hard. C to A, that is a much harder task. So, there's a long way to go. And frankly, I don't think the incentives are there for these types of companies to do the right thing. And we're not living in a state or a world where we're telling tech companies what to do and regulating them appropriately. So that's one kind of microcosm of AI. There's certainly use cases for AI. I think they do great administratively. I love it when they make spreadsheets for me. Um, but when we're talking about providing mental health support, a lot of people rely on ChatGPT for social support. Maybe that's great in for a little bit, but I don't think there's any replacement for human connection. So that shouldn't be that doesn't mean people have access to mental health support.
I agree with that. I think I have a message in here for you about Sessa. If you would like a
Oh yeah,
contact.
I have a contact who has, as far as I know, been assisting folks get on the state. Uh, I'm always happy to have more contacts, so feel free to send me an email with their information. I'm I love more contacts and more people to bug because then I don't have to bug the same person all the time.
I had a question I was going to ask, but it's totally fleeting. So if I if I remember it, I will ask.
You're
Um,
all good though.
any other audience questions? Want to type them in the Q&A?
And while you're thinking of any other questions you have, I will say, I've got a couple bill numbers, but we've still got a lot of language that are bill language and bill numbers that we don't have, and I'll be getting those as well as, oh my goodness, excuse me, as well as fact sheets for bills in the next few weeks. So I'll try to be good about sending those out as expeditiously as I can. And in the meantime, too, I meant to put this in the chat and or maybe in the Q&A, or I'll just send it out. Danielle, I'll send you as well a link to our Advocacy Action Center. So throughout the legislative session, I'll be sending out action alerts to our legislative liaisons, which I think Danielle, you're in Northern Illinois, if I remember correctly. Maybe there's somebody else, but uh, and then via social media and our newsletters, we'll send out action alerts. Those will live on our action center as well. So you can always check, if you're curious about what's going on or what bills we're supporting, that will all be on our action center, which works pretty well, and it makes it really easy to send your legislators letters and call them.
You brought me back to my question. It was going to be, what can we do for you all? I really liked when you said, if you're not at the table, you're on the menu. So we want to be at the table with you.
Yeah, yes, yeah. Those action alerts are great to do and to participate in. And legislative session is it can be difficult to find your local legislators in district. However, that said, you don't need an action alert or wait for me to tell you guys what to do. You guys know what's going on in your community, know what issues you guys are seeing. Even talking about Medicaid and asking the question you asked me, that's a great question for Rep West and your other state legislators as well, because they know that they have to answer these questions. It's their job. Whether there are good answers is another thing, but they need to know that you're watching them and that you're aware. So, even as simple as sending an email, just introducing yourself, or giving their office a call just to introduce yourself, or just showing up at their office too. You can do that. Those are great ways to get involved. But those action alerts is making sure that we're keeping our legislative agenda moving forward is also important. But I do, again, I just want to really stress, like, you do not need to wait for me to reach out to your local legislators, and certainly not only your state legislators. Go find your county board president, your county board commissioners. um, you know Tell them that they need to be doing more. Their McHenry County Health Department does a lot. Lake County Health Department does a lot. It's not just DuPage County Health Department, and Cook County obviously is big too, but health departments have a large role to play, and maybe they're already doing something. Because they're not always the best at reaching out and telling people what they do. But I think making sure that, like I said earlier, who your elected officials are, and they know who you are, because then when we show up when we need something, they already know.
I,
Yeah,
I think you're answering this question as it's there, just describing
yeah.
how to interact with legislators on behalf of NAMI. So
Yeah, yeah, and more. I mean, that I think that's how we should all be interacting with our legislators. But if you're asking how I interact with our state legislators, in my role, I communicate with quite a number of them on a regular basis. I was in a meeting a strategy meeting with a legislator today, for example. But my goal is to always interact with them more. And the other thing I would love, I always am trying to plug. Um, if you are going to meet with your state legislator, you set up a meeting, and you are feeling uncertain, or you just want to go with somebody else, or you don't want to go by yourself, or whatever. Or if you want, if you want to talk about HB 2960, but you don't feel confident about, answering questions or talking about that bill, you always reach out to me. And I live on the far north side of Chicago. It's not that hard to get to the Rockford area or northern Illinois, wherever you're trying to go or meet your state legislator. I'm happy to come with you. I'm happy to join a virtual meeting if that's how you're meeting, or I'm happy to just help you prep. So if, y'all aren't out on your own, feel free. You can always reach out to me. I'm here to be a support for you guys.
we appreciate that a lot.
Yeah. And yeah, and I mean, I also go down to Springfield relatively regularly, as much as needed, but as little as possible, I think is kind of how I think about it. It's kind of pain to get down there. So but no, I do go down there and interact with them directly like that as well. So um yeah.
I know at times you reach out for people with different like lived experience for some of these bills. I think is there like a more efficient way I can be responding to that? It's kind of like as needed basis, I imagine.
Yeah, it's kind of as needed. I think it's so I'll say a couple things, and actually you reminded me a great way or another way that I want to plug to get involved too. So yeah, it's it's hard to predict what kinds of stories we'll be looking for moving forward, especially because those opportunities kind of come up, not necessarily related to a specific bill. But with all of the federal, especially federal changes that are coming, some types of experiences that we're always looking for are, folks who rely on the ACA market for their insurance. I know our federal legislators are hungry to hear from folks who are directly impacted by that, or if you or a loved one is worried about work requirements for Medicaid, or you're worried about not being able to meet that work requirement, or if you do work, losing your Medicaid and then having nothing. Those, even if you don't actually lose Medicaid, those are the stories that we need, and those are the stories that we can always use and help connect with especially federal legislators. But for state legislation, it can get a little more tricky, because we're more in the kind of weeds of what we're looking for, and if you don't have just the right person, it doesn't matter to some legislators. But I think for you guys, if you kind of look at our legislative agenda and our main bills, if you have folks in your community that say you have a mother who, perhaps I'm just going to use this example because it's the exact profile that I had talked about earlier for the campus mental health thing. If you have a mother who lost their daughter to suicide, and that they're really passionate about access to mental health services in schools, for example, we have HB 2960 that, that's a pretty direct connection. So kind of, I think, thinking generally like that, and that's a question that I think all of our affiliates and we are trying to answer. And I mean, I think NAMI everywhere and is also trying to answer, because it's tough. to keep track of all of the different stories and all of the little details that matter. Oh yeah, and the thing that I was going to say related to that you reminded me. Um, we also have a storytelling training that we have more folk or more trainers trained in than we ever have before. So NAMI Smarts for Advocacy is NAMI's storytelling training. We now have 4 people across the state who are certified trainers, myself included. So we've got, or no, we have 5. We have 3 people at local affiliates, and then me and Emily Fagan at NAMI Illinois are trained. So we will, as we kind of get into spring, we'll be offering those sessions. Those are a great way to think about your story a little bit differently. If you've told your story before, it's kind of the same format, but really condensed into like a 90-second advocacy focused way. So, I don't think I've ever had anybody tell me that they didn't like NAMI Smarts. Maybe I'm wrong about that, but we'll be able to offer those virtually and if you have somebody at your affiliate who is interested in offering NAMI Smarts, there are I think I sent this. Oh shoot, I meant to send this out like yesterday or today, but the call for applications for another facilitator training just opened up in March. So I'll be sending more information about that later Danielle, to you this week.
Yep,
And I
thank
would
you
highly encourage you to send somebody.
for sure. A couple more questions and comments in the chat or Q&A. Can you recommend a way for us to keep an eye on upcoming legislation that affects mental health? Would it be that platform that you were talking about earlier?
Yeah, yeah. We'll I don't list necessarily all of the mental health legislation that's out there in Illinois, but all of the bills that we support, there's a kind of a spreadsheet that it's nicer than a spreadsheet, but it looks kind of like one. But that it has all of the legislation that's active that we support. And if you're also, if you're interested in kind of attending regular monthly meetings, uh, where there's a group of advocates that just talk about mental health policy, or do you want to be on an email list? I've got a couple email lists or listservs that I can get folks signed up for. And the Mental Health Summit is a group that I participate in every month, and there's a lot of NAMI folks on that call. There's a lot of grassroots advocates, and Mark Hireman, who's affiliated with Mental Health America of Illinois. He runs that group and sends out pretty regular legislative updates. So if you want to really keep track of mental health legislation in Illinois, I'm happy to hook you up.
Yeah, please do share that. Mentioning there was a person, so there was a situation where someone's medicine went from $9 a month to $300. They said they simply had to stop taking them. Is there a way we can advocate for them?
Yeah, that's a good question. I think depend with that being the only detail I know about the situation, I would uh, reach out to their insurance company. Well, first I would probably go to their pharmacy, maybe with them, and ask the pharmacist. I think they off. That's a very common question that they get. And then the next step would be going to your insurance company, and because there are and the prescriber as well. I would go to all 3 and ask them, or tell them what the problem that they're not able to afford that medication, and there are either programs or generic alternatives, or unfortunately, I know mental health medications are not interchangeable like that all the time. So that might not be an option, obviously, but hopefully there is something that can be done. This is not a new thing that pharmacists and providers deal with, and quite frankly, prescribers need to be better at it, and they're not.
Clocked it. This
Yeah.
is kind of like a side step, but do you have any information on the speaking with law enforcement trainings from NAMI, Illinois, if
Ooh.
we're having any, or nationally even?
That is a good question. I will check in with Emily, our training director, on that.
Okay, thank you. We have about 5 more minutes if there are other questions. Tony, thank you for all of your insight. It's
Yeah, and thank you guys for, well, Danielle, thank you for organizing this, and thank you to everyone who's on the call this evening. I mean, there's you could be doing literally anything else with your Tuesday evening, and you are here sitting on a Zoom listening to me talk for an hour and a half. So, um, excuse me. That I really appreciate the dedication of everyone on this call and the advocacy that you guys do, whether it's systemic, personal, you know, uh, it's not a one person job to do all this. So, I'm not here for myself. I'm here for you guys.
well, I couldn't have ended the session more perfect. So, no, we really do appreciate all you do for everyone throughout Illinois and us. So, oh, thank you and great job from Warren.
And Warren, thank you for all of your great questions and comments. I love the engagement. Um, you get an A+ advocacy engagement result from tonight's session. And I've said it a few times, but never hesitate to reach out to me. Never hesitate. I'll throw Danielle under the bus and say never reach or hesitate to reach out to her too. With any questions, I'm here to be a resource, like I said.
Thank you. Warren said go Bears also, by the
Go
way.
Bears.
If everyone's a Bears fan, I hope you are.
I'm from Wisconsin, but
Um,
neither here nor there. I was never a
gotcha.
Packer fan growing up. I have never affiliated. So
I
I
got
was
you.
up. I grew up with the Urlacher Bears being in Chicago, so I was a fan of that.
I'm here for it. All right, everybody.
All
Thank
right.
you so much. And I will post this recording on our YouTube and website here soon, so then more people can even learn.
Perfect. Yeah. Feel free to share the link and I can share it around too.
Thank you. Appreciate it. Have a good night.
Great. All right.
Bye,
Thanks so much. Have
everyone.
a great night, everyone.